have decided that the global monkeypox outbreak represents a public health emergency of international concern.
In general, monkeypox is regarded as what we call a self-limiting illness. And normally for many people, you get some sores, blisters on the skin. People sometimes have swollen glands and a headache and sore muscles and sometimes a temperature and can feel unwell. But we are seeing more severe presentations around the oral symptoms in the mouth. So people presenting with really bad ulcers in the tonsils, the mouth, and then also in the anus, really, really painful lesions. It's spread through sexual networks. The world is opening up, sort of parties and places where sex can happen, where lots of people meet up and end up having sex. And it's spread in that way, and it's spread from country to country with international travel and people wanting to socialize and travel again. Vaccination campaigns have opened now in the UK, particularly in London, through sort of pop-up clinics. The sexual health doctors are working 24/7 in the clinics, and also open up at weekends, offering slots for people to come be vaccinated. And they're offering it to people at highest risk. And they're also offering it in other countries. It's being offered in Canada, and it's also New York is doing a big push now. Vaccine, which is actually for smallpox, is 86% effective if you give it within 4 days of exposure. It can be given up to 2 weeks afterwards, and if that's the case, it may attenuate or reduce the severity of the disease. We've seen within the space of 3 years 2 pandemics, and that's why we need to take this seriously and realize we're interconnected, and if it affects somebody, it affects everybody, and we're one world, and we're not immune, we're not exempt. They're not diseases of African people, they're not diseases of gay people, they're not diseases of anybody. They're diseases that any of us can get, but they can spread in different communities relating to patterns of behavior and environmental circumstances, and that's what we have to understand.